Hi, hello everyone. Today we will discuss semen analysis. Semen is a gray opalescent fluid which consists of suspension of the spermatozoa in the seminal plasma. It is made up of the secretion of all the accessory glands of the male genital tract. Sources of secretion are testes 5%, seminal vesicles 40 to 80%, prostate 13 to 33%, bulbourethral and urethral glands 2 to 5%. Semen examination is done for the investigation of infertility, success of vasectomy, medico-legal cases like rape, for storage and artificial insemination. Analysis of semen consists of first sample collection, then gross examination, then microscopic examination, and then chemical examination. Sample collection. Patient is instructed to collect the specimen by masturbation after 4 to 7 days of sexual abstinence. The sample is collected in a clean glass tube wide-mouthed container or in a properly washed dry condom. The sample is submitted in the laboratory immediately but preferably within the 1 hour of the collection for examination. 2 samples should be collected for initial examination with an interval of not less than 7 days to not more than 3 weeks. Gross examination. Semen is examined grossly for the following features. First, color, then volume, then viscosity, then liquefaction, and finally reaction. Color. Normally it is whitish, grey white or slightly yellowish in color. Volume. Normally the volume of the semen is in between 2.5 to 5 ml and the volume is slightly more in patients of infertility and the volume does not vary with the period of abstinence. Viscosity. When ejaculated, semen is fairly viscid and falls drop by drop. Reaction. Normally it is slightly alkaline with a pH between 7 and 8. Liquefaction occurs because of the presence of fibrinolysis. Normally liquefaction occurs within the 10 to 30 minutes. Microscopic examination. Semen is examined microscopically for the motility, count and morphology. Motility. Place a drop of liquefied semen on a clear glass slide, put a cover slip over it and examine it under the microscope, first under the low power and then only under the high power. Normally within 2 hours of the ejaculation, more than 60% of spermatozoa are vigorously motile and in 6 to 8 hours 25 to 40% are still motile and this is expressed as sluggishly motile and non-motile. Count. This is done in Newbar's chamber using a WBC pipette. Draw a liquefied semen in WBC pipette up to mark 0.5. Then draw the diluting fluid up to mark 11. The composition of a diluting fluid that is used for semen analysis consists of sodium bicarbonate 5 grams, formalin 1 ml, distilled water 100 ml. After mixing it properly, charge the Newbar chamber. Allow the spermatozoa to settle down in 2 minutes. Then only examine. Examine under the microscope and count the number of spermatozoa in a large peripheral squares used for TLC counting and multiply the number by 1 lakh which gives the number of spermatozoa per ml. Normal values are 60 to 100 million per ml. Abnormal value will be less than 20 million per ml. N is the average number of sperms. These are the sperms that are counted within the 2 squares. Morphology. Prepare a thin smear from liquefied semen on a glass slide. Stain it with any one of the Romanesco stain, Pap stain or H&E stain. Observe at least 200 spermatozoa for any abnormality in their morphology. Normally 80% of the spermatozoa will be normal. The abnormal forms of spermatozoa are with double head, swollen and pointed head or double tail and rudimentary horns. Also look for the presence of RBCs or WBCs or epithelial cells if any. Chemical examination. Chemical analysis of semen consists of fructose test and acid phosphatase test. Fructose test determines the androgen deficiency or ejaculatory obstruction to the semen and the level of seminal fructose is low in both these conditions. Normal seminal fructose level will be 150 to 600 mg per deciliter and the fructose is measured qualitatively by the resorcinol test. Take 5 ml of the dilute HCl in a test tube, then add 1 ml of semen to it and add 5 mg of resorcinol and boil it. Interpretation. Appearance of red color indicates presence of fructose, which can be measured by a spectrophotometer. Acid phosphatase test. This test is used for seminal stain on vaginal aspirate, on stained cloths, and in medical legal cases. Normal semen has 2500 Ka units per ml of acid phosphatase. Inference. It can be normal study or aspermia, total absence of ejaculate. Azoospermia, total absence of spermatozoa. Oligospermia, decrease in the volume. Oligoazoospermia, decrease in number of sperms. Polyzoospermia, above 350 million per ml. Necrospermia, that is dead sperms. Sperm counts is decreased in vasectomy, varicocele, primary testicular failure, secondary testicular failure, congenital vas deferens obstruction, and endocrine causes. The seminal analysis report will be volume. Normal range will be 2 to 6 ml. You have to write the volume that the specimen you received. Liquefaction time, normally it is up to 1 hour, 15 to 60 minutes. You have to write the liquefaction time of the specimen that you received in the report. Appearance, viscous, white or grey. pH 7 to 8 or 7.2 to 8. And under microscopic examination, sperm count, whether it is less than 20 millions, how much it is. Count and write. Sperm motility, greater than 50%, sperm viability, greater than 75% or less than 75%. Sperm morphology, greater than 30% or less than 30%. Agglutination and the biochemical test, fructose test, positive or negative. Acid phosphatase test, positive or negative. Leukocytes, less than 5 per HPF or not. If any RBCs, mention it. Thank you for the patient listening. Please subscribe Dr. Ravichandra Official for more videos.